Well, welcome to Dr. Murphy's vein treatment. We have a lady today. We're not going to mention her name or show you her face, but she's 21 years old and she's had 13 kids. Now we're all trying not to laugh. So she's got these spider veins, and Michelle's going to pan over and take a look at these veins. These are typical spider veins. And what happens with these veins, and you typically see them in women, these are what they call incompetent venules. So they're a little bit on the large side of capillaries, but they have valves in them, and they become incompetent, and they fill up with blood. And what we're going to do today is we're going to take a very small needle, and we're going to actually inject it into these real small veins. Now, to give you an idea how small they are, that's my thumb, and that's how small those veins are. And we're actually going to get a needle in those veins, and we're going to inject some what they call salty water, very, very salty water. And it's going to burn a little bit, it's going to sting a little bit, but it's not that much of a discomfort to the patient, so she's going to be just fine. And she's actually done this before. I actually performed this particular procedure on her, I don't know, 3, 4, 5 years ago, and we were just kind of messing around, and she's like, "Can you do anything about these veins?" And I'm like, "Yeah, I can do something about it. You know, I'll show you what I can do." And she asked me, she goes, "Is this going to hurt?" I said, "No, I won't feel a thing, but thanks for asking."
That's true.
Yes. So, but it didn't hurt that bad.
No.
So we're going to...
Excuse me, I didn't mean to... Oh.
So we're going to draw up some solution. It doesn't take very much. We're going to change our needles out. And this is the needle we're going to use. And you're going to see it's very, very small. So this is my finger, and this is the size of the needle. You can see how small it is. So we're going to start on these right here on the side. And we're going to go on the bottom side, and we're going to inject up. Here's an interesting commentary. I actually was taught how to do this by a great dermatologist in Kansas City, Missouri, and his name is David Kaplan. And he showed me how to do this about 30 years ago. And I talked to him the other day. He's still a good friend of mine. And a lot of doctors that read medical journals know him because they read his articles all the time, because he's the one that publishes them the most. Great guy, though. I had a rash that came into the clinic, and he actually called me from Chicago O'Hare Airport to tell me about this rash. So here we go. We're going to put the needle in at the very bottom, and I'm using magnifying glasses as soon as I get my eyes adjusted to what I'm doing here. But it takes a little bit of talent to inject it into there. You have to sneak that little thing right in there. There we go. Now they're starting to disappear. We're going to come up here. But they're right below the skin. Can't quite get into the venule. Let's try this one here. The problem here is these capillary... No, you're fine, you're fine. Yeah, put your knee up on my leg there. There you go.
Let me get rid of that shoe.
That's it. Be comfortable. The problem here is the capillaries are actually smaller than my needle, but this is the smallest needle I can use. I can snake it in this one right here. It's right below the skin, right there. She can feel that. There's like a little burning sensation. Mm-hmm. There it is.
Ooh, look at it disappear.
Disappeared.
Yeah, that's it right there.
Whoa.
Now those are all burned. Those will burn up. I'm going to pull the needle out, and it'll collapse the veins. And that solution is in the veins right now. And what it's doing is it's burning them, and they're going to scar on top of themselves. That's all we want to do. We hold a little pressure and give a little rubbing on it. So we're squashing them right now. Now, when I take this off, they're going to come back, but they're going to look fiery red. But right now, I'm holding the veins together, so the side walls of each of the veins are burning against each other. And this is not, the complications from it are none. You can't get a blood clot, it can't break off, can't go to your lung, can't go to your heart. Nothing happens here. There they are. And see, now they're coming back, but they're fiery red. They're a lot redder than the surrounding veins. You can see how bright red they are, which is what we're looking for. Those are burned. And those will not come back. They'll eventually scar up and wither away.
Is there much discomfort for you as the patient?
No, there is not.
Just a little poke here and there?
Well, she can feel a little sting.
A little sting,
yeah.
but it's not.
And see how this one's just really twisted. I'm going to try and snake it in there. I mean, it's just right below the skin. Going a little too far, get a little deep, come back out. There we go.
Starts to disappear.
Starts to disappear. You can see now it's burning. You can see the fiery red. That's all I need. See, these over here are fiery red. Those will disappear too. So these
They're
veins,
definitely different in color.
these veins here are all sclerosed. This is the hardest part, is when you pull the needle out, they tend to back bleed a little bit, but it's just fine. I'm just going to hold some pressure on it. Yeah, this particular lady that we're doing this on today, her and I have known each other about 30 years, which is older than the Michelle who's holding
Then
the
your
camera.
technician?
Yeah, my technician.
And the ones you did before didn't come back. I
They
mean,
don't.
It's
You
just
can you can get new ones. So, and typically a lot of women get hit with softballs in the legs, and it smashes the veins when they play softball, and they'll get a spot that'll come up from it. Or if you bang a dresser or something like that, you can get these.
I do that all the time.
Yeah.
I run into everything.
We're going to do these right here. I'm trying to get it in right here. Sometimes you pull the skin a little bit on the tight side. It makes it a little bit easier to get in. There it is. These are very small. There they go. See how they're disappearing?
Mm-hmm.
Those are burning all the way up. She can feel that climbing up her leg right now. They call this sclerotherapy. Now, I can't do this in varicose veins, the big ropey veins that come down. That's a little bit different.
So what's the difference between spider veins and varicose veins?
Well, they're the same as far as the pathology goes. In other words, they're similar in how they happen. It's just that the varicose veins are huge. They can get the size of my little pinky. I mean, they get just the big ropey veins that go down people's legs. And they typically have to do a thing called strip them. You can see those are all pretty much gone. Now they're coming back. They're fiery red. That's what you're wanting to see when you get done.
Mm-hmm.
So those will disappear.
Yep, look at the red.
Mm-hmm. That's what I wanted to see. Let's do this one over here, Michelle. Right over here. This one right on top. This will be a good one.
Just get those out of the way,
Okay.
would you?
Put your foot right up on my knee there. It's hard to get this needle in that little venule that's right there. You have to kind of bring it in, back it out.
There it starts to disappear.
Mm-hmm.
And then you get the burning sensation.
Yeah,
It's not bad.
You
It's,
can see it getting real red again. There it goes.
Mm-hmm.
How about these right here?
Yep. That's my light over there. Nope, you're fine. You're fine. Stay right there.
okay.
So rest it right there. We're good. But you can tell by looking just how small these are and how small the needle is to get in there. And what you do is when you're injecting, you put just a little bit of pressure on the end of that syringe. And when you start seeing them disappear, you know you're in. Can't quite get that one. There, we're almost there. It's working. Not much. So it's kind of a trial and error.
Sometimes you
thing.
get a big
Sometimes you do, sometimes you don't. Let's try this little area right here. This will be tough because it's got a big turn to it, but I'm going to try to get it right in there. There we go.
That one went.
Yeah, there we go. And she can feel that now.
Mm-hmm.
The mistake I think some doctors that do this that they make is they tend to over inject, and you don't want to do that. You don't want to cause what's called a wheel, like you're getting a TB test. You just want to be gentle, slow going, not be in a rush. But even with these little ones, it might take multiple injections, but you can get rid of them. It takes patience.
Very tedious.
I'm sorry, sweetie?
Very tedious. for the
Yes,
doctor.
yeah. So it takes a lot of work to do this. It's pretty tedious to be for sure. I'm trying to snake it in there. There we go.
Ooh, that one was good.
Yeah.
Mm-hmm.
And see, it's still burning. It's still escaping. There's no wheel formation. We're doing good. And it's, if you look at the area it's spreading out to, it's even out to this finger right here. But all these veins over here
How
are
can you
all
tell?
burned. I'm watching it as we do this. I can see the veins disappearing over there. Now they're going to come back
And look real red.
and look real red, like that's what we're wanting. Come in this side on this one. Michelle loves her GoPro.
Mm-hmm. It's mine, this little camera.
Your what?
It's called a GoPro.
Oh,
A GoPro.
Yeah, I know.
Next thing I'm gonna have a helmet on my head and I'll be just walking around with it up here.
Here we go.
Yeah, that one was good.
She's the one that talked me into doing all these videos. She's in love with this Dr. Pimple Popper. So every time I get a person that comes here with a pimple that needs to be popped, I call her because it just thrills her to death for me to pop these pimples and stick scalpels into people's abscesses.
Yeah, if anybody watching this would like to see some pimple popper type videos, you let us know because
we're not going to do them.
Because
so
I'm
you can't go here.
obsessed
You
with
can't
them.
come to our videos because I'm not putting pimple popping on videos.
Yet.
She's tried, but I'm not doing it. Here it goes. And see that needle's actually half in the vein and half out. The end is just barely in, so you can see the fluid leaking out. That's my fluid. So that's how shallow these veins can be. But you can see how it's burning red. It's fiery red. But my needle is literally that clear fluid coming out. That's actually the hypertonic saline. So on this particular vein here, literally the point of that needle was half in the vein and half out. That's how small it is.
Wow.
Okay, we're going to go upstream here a little bit and do these up here. There we go. Man, it's just tough to get this needle in these little things. Here it is.
Yeah. Do you feel it when it gets it?
Oh, she knows when it gets it. See how they're all turning fiery
They
red?
start to disappear and they turn.
But these will all be
Goes
gone.
from purple to red.
Now I'm just slowly leaving it in there. In this particular solution, this is just very salty water, is burned inside those veins. But those will all disappear.
How long does it take for them?
About 3 weeks. About 3 weeks, they'll shrivel up and turn into nothingness.
Well, I can't wait to see you when you come back.
I can't wait for it either.
Try to put a little bit in this one here.
There it goes.
Once again, you can see the medicine leaking out of the hole. Or the saline, rather. Just salty water. Clean up our mess here. Clean up the human pin cushion. What else do we have here? I'm going to leave those up there alone for now. Let's work on these down here a little bit. See if we can't get some good ones. These ones over the front of the leg are always tough. These are going to be a lot shallower. You're okay. Just
Does it
rest
hurt
your-
more when you do
I don't think it really hurts anymore. Actually, I think these up on top would hurt more than these will. These typically are a little bit deeper. So here we go. Should be really close to being in. There they disappear.
Wow, that one really disappeared.
Yay.
And she can feel that. But that'll never come back. And if you look, see how the blanching has went all the way up through here, even up to here. She felt it up to here, where these drops are. I'm gonna put those drops. She felt it up to there, and it sclerosed all of those.
Wow.
So with that one little shot, we took care of a whole bunch of them.
That's awesome.
Yeah, it is.
Move it up a little bit. See if we can get some of these here. These are just tough. They're just kind of somewhat visible.
Broken up.
Yeah, somewhat visible, somewhat not, but we'll see if we can't do some here. Okay, we're in the vein. But you can tell right here that the vein is actually smaller than my needle. And so what we have to do is get it in the vein. Just like that. And see how they're all turning fiery red. Now they're disappearing. Those are all taken care of.
Great.
Oh.
That's enough video, isn't it?
I think so. All right. Well, there was that. You're going to keep going and I'm going to leave.
Yes.
All righty. Well, we'll see you later.
Miss Pimple Popper.
Yes, thank you for listening.
Dr. Pimple Popper.
How about this ugly one on the back?